55-year-old female. This is a PRP injection number 3 for chronic greater trochanteric bursitis. She's a pretty high-grade tear of the gluteus medius tendon. She also has some moderate tendinosis as well, at least of the gluteus minimus, with probably some intrasubstance tearing of that as well. So she had 2 PRP injections. She's got maybe about 20% relief overall from the shots.
Here we are looking at the greater trochanter. We're in an axial plane. You can appreciate the apex of the greater trochanter as well as the gluteus medius tendon. That's just to the right of that or posterior. You can see how it's thickened. There is a mild to moderate greater trochanteric bursitis just underneath the iliotibial band. And here we're trying to delineate the different facets. You can appreciate that rounded posterior facet. And the greater trochanteric bursa lies on top of that. And on top of that is the gluteus maximus muscle. Here you can see all the facets, you can appreciate the apex, and again you can appreciate that mild to moderate greater trochanteric bursitis. Here we are starting the injection. We're using a 3.5-inch 20-gauge spinal needle. We keep the stylet inside the needle while we're initially placing the needle so the needle can cut through the tissue easier. And here we're just trying to feed that needle right underneath the iliotibial band into that greater trochanteric bursa, just above the gluteus medius tendon. You can appreciate the very tip of the needle now, just above the gluteus medius tendon. This is just where we want our needle, as we essentially, at least in this procedure, I just wanted to bathe the surface of the gluteus medius tendon in platelet-rich plasma. So now we're taking out the stylet. We are putting on our platelet-rich plasma. This is using the Harvest kit. It is a white cell-rich, somewhat of a red cell-rich prep. And now we're starting the injection. You can appreciate how we're distending that space between the gluteus medius tendon and the iliotibial band, and essentially just distending the greater trochanteric bursa. And we're just going to finish our injection by injecting about 10 cc's of platelet-rich plasma into the greater trochanteric bursa. And about 3 weeks follow-up after this injection, she was roughly 50% better. This was given about 6 weeks after the second injection, and overall she was very happy with the results of this third injection.